When the arguments for remaining or leaving the EU are laid out over the coming weeks, who will you trust? Politicians, economists, business leaders? What about scientists? Today, Stephen Hawking led 150 Royal Society scientists in the charge for the EU. In a letter to The Times, they argued that leaving could be a disaster for science, pointing to the recruitment of researchers from continental Europe. We are, the scientists said, a net receiver of brains. And they went on to take more than £2 billion more in research funds than we give to other EU members. But that claim was disputed by the grouping Scientists for Britain, who insist we put far more in than we take out of the EU. Well, joining me now is Angus Dalgleish, Professor of Oncology at St George's Hospital in London, who thinks British science is better off out of the EU, and Khalood Al-Jamal, Associate Professor of Nanomedicine at King's College London, who thinks British science is better off remaining in the EU. Good evening to both of you. First of all, Professor Dalgleish, scientists in the EU greatly increased the level of EU science as a whole. Isn't that true? It's axiomatic?
I can't disagree with that. They probably do, but we don't need to be in the European Union for that to be the case.
But what is suggested is that scientists will always, and have always, been involved in international cooperation. So actually, membership of the EU per se is not what drives international cooperation.
I think it enriches it in a way, because we have reached a state where we have science without borders. We can send our students over there, we can receive students, and this is something that cannot always be counted financially. So the amount of intellectual input that we have into science cannot be substituted or cannot be the same if we are out of the EU.
If it was a case of leave, not remain, those borders will be back up again.
Well, I don't agree with that at all. The first thing I'd like to say is that leaving the EU is not about leaving science. I mean, the EU has been misconstrued, I believe, by the scientists, thinking that the EU is just a vehicle for science and for funding. It is actually, it's a political union organisation, and it is over and above that. And we do not need to be in that political organisation in order to do science. I would just like to challenge the fact that's been bandied about and was repeated by the Science the Letter, that we get slightly more back than we put in. Put in. And that's, I'm not going to dispute that, and that's on competitive grants, absolutely. But it conveniently forgets that there's an infrastructure fund where we only get £2 billion back out of £54 billion. And so if you add it all up, we put far more in than we get back.
Dr. Al-Jamal, I wonder if you would agree that because of our close relationship with the EU, sometimes it would be perhaps easier to seek an alliance with scientists there because of the rules that govern funding, rather than taking a risk of going further, which might deliver maybe slightly better outcomes, or maybe not, but we tend to stay within the boundary because it's easier.
Well, actually, there has been a 50% increase in what we produce if we do research on an EU level than if we do it locally. So I think the amount of impact that we get is much higher. And we would like to strive as being outstanding, not only within the EU level, but globally. And we may lose this if we're out of the EU, because there might be not the same interest as now of people coming here to the EU.
I think that's really part of the scaremongering, that if we leave EU it'll all be a disaster and the funding will disappear. I mean, it's our own funding to start off with, so if we actually left the EU, we should be responsible for our own funding. We're one of the largest trading blocs in the world, and we've led science for years, all the great innovations.
What about trialling? Does membership of the EU help trialling? Are we different rules within the EU and out with the EU for trialling?
Are you talking about clinical trials?
Yes.
Well, there I can only have to refer to the Clinical Trial Directive, which I became a victim of, and I would have probably been going on quite happily, a bit oblivious, like a lot of other people, to the European Union, if it hadn't stopped and interfered with my treatment of making autologous bespoke vaccines for my patients. And I was suddenly told that when the European directive came in, I would be breaking it, and I was no longer be allowed to do it. In fact, I'd become a criminal overnight for doing what I was doing.
Can you just tell me very briefly, in the name layman's terms what it was you were doing?
I was making vaccines, taking blood from patients' arms, taking the blood, putting it in the machine, and getting the antigen-presenting cells and putting antigen on to make a vaccine of the patient's own vaccine and injecting it back in. And they determined that the laboratories that we were doing this in no longer met basically big pharmaceutical conditions, and we were stopped, which was completely and utterly ridiculous. It was a rule for big pharma getting drugs through for registration.
I mean, you support Remain, but do you think that there could be reform?
I think this is one view of one particular type of research, but if we're looking at the different in multidisciplinary research, where we're looking at attracting top scientists in different...
But I would suggest that perhaps Professor Dalgleish is a top scientist and he was restricted from doing what he wanted to do. And I wonder if we should, you as a supporter of the EU, can see that there needs to be change.
Well, maybe there can be some discussions about the regulation and why this has been banned from being... So the solution is not to come out of the EU, but maybe looking at other ways of solving the problem.
Thank you both very much indeed.